I'd love to hear from His Excellency Ambassador your thoughts on this, please.
Thank you very much. First of all, I want to thank Mr. Allen and Ms. Khadija for such great gathering. I'm first time in this meeting as H20. I know it is not easy to bring all these professionals from all over together. It is not easy. It's a big job. And congratulations for 9 years achievements, and keep going. The second thing, this morning, I think during the breakfast, we are talking something very, very important about the health professional, about the NCD, about the investment, about innovation, about partnership, about all these things. So when you come to the parliament, you know, I represent the Mediterranean Parliament in GCC, as also I am a chairman of the CGS, which is the arm of the research think tanks of the parliament. So it is very important to convince the politician and also the decision makers how to convince them, as Mr. Brock mentioned, that is when you making a budget for the healthcare, it is not expenses. It is investing in the people, investing of the health care of the communities. So this is very important to convince the politician and this. So through the member of parliament of Mediterranean, we represent almost between observer and the permanent member around 44 countries. So to convince them that, because these people or at the parliament, they represent the people, not as a government. So how their role to convince that making a budget is not expenses, it is the investment. And to convince them, you need to have the facts and figures. So that's why, after 18 years, 19 years, we try to do by the talking, conference, workshop, doesn't work. So we established the center CGS to make as a reference, as a research, and having the partnership with other organizations, such as United Nations, such as now we signed this morning with the H20, and other. So this is how we need to make the decision maker to believe when you have something, facts and figures and research. So that's why the first our conference or summit was in cooperation with the United Nations last September during the annual meeting, which was the trust and reputation. We are losing the reputation, we are losing the trust on our own people. So that's why how to bring the trust of the public and private sector together, how they can work together, how to add. And we know that a lot of the NGOs is facing a lot of problems because of lack of finance. This kind of thing we need to bring based on the facts and figures and research so the people can believe. And it's not mean, I'm not saying to force them, but to encourage them that there is something, we need to take care about that. It is not my decision or other decision, it is all of us. That's why we start also the first thing we focus on the One Health in CGS. It's doing very, very good. It's not only the healthcare, it is the food and security, it is the environment, it is so many things can be involved. But yes, this morning when we talk about innovation, we are where we are about the innovation. We are sitting in such beautiful building here, and which representing the board about I think this is very good to host such an event, to have such meeting in the World Health Organization. And thanks for the Dr. Tedros to give this opportunity and today is speaking. I think every one of us has a responsibility. It's not mean we are here in this meeting and after that we forget. No. And I think we need to work together and keep and consider this H20 is our meeting. And looking forward, how we can make it happen. And the people feeling that and trusted on us. If we are losing the trust and reputation, we can't help. Thank you very much.
Thank you. His Excellency, I'll ask you, please, in one sentence, if you can please share one recommendation for G20, G7 health and finance ministers and leaders as we enter the next G20 and G7 cycle. And the one sentence isn't strict, it's just what I've got on my paper, but we are trying to get through everybody.
Sure. I think the focusing supporting the primary healthcare and prevention and innovation in health. This will support a lot. When you focus on supporting the primary healthcare and prevention, it will help a lot to support the hospital to get the better treatment and also saving a lot of cost. Thank you very much.
Thank you very much.